I feel like if you're ever nervous, just be like, well, and thank you, and then just end, and let someone else pick up, and we will.
No, I can't.
My son had connected us. Maybe you did meet her.
It can't be.
You're going to be told.
No, it's just a comment.
Like
It's just like funny.
I get
I was like,
so nervous.
I've been on like MSNBC, but I've never been in front of a crowd.
You're going to do great. You're gonna, just imagine it's just like our Zoom call. And,
Yeah. Thank you. Yeah, I'm like also like I think probably have like the least amount of experience of any of you guys.
I don't even have a job.
That's not really true.
I'm an employee. Think about it.
It's hard. In a way, you're kind of living your dream.
Oh, yeah, the dream. Yeah.
Do you think you'd want to be in a newsroom?
I have a son with medical vulnerability, so he is homesick a lot and he has a lot of appointments, and so I don't think I can handle the
Yeah.
I need to set my own schedule. But I've actually never been in a newsroom, so maybe I'm like overthinking how much work it is. I don't know.
Yeah. I mean, it depends on the newsroom, I think.
Really bad depression. So you think you get through several things are coming close to early. And I tell them, don't worry.
Yeah. I've thought about moving to.
If you think you're coming early, but they're usually
Yeah.
okay. So, and I'm sure.
You need to turn it off between.
You could just pick up.
On my end, so right now, yeah.
That's
Okay.
right.
Control. You don't have to.
So if I have to. And then.
I know. I've thought about there's a job open that I was like,
Hi, I'm
I could
Eileen.
apply.
No, I mean, I feel like right now I work like.
I appreciate it. I think it's
so
easier for us to
just,
talk ourselves out of
set
going.
hours.
And that's like, oh, I'm
just
functioning, I'm
strictly
fine.
enterprise and investigative work.
Yeah.
Even though like technically I was.
It's pretty though. I like that
on
scarf.
staff, I made my own hours.
Yeah.
You know, and I
Yeah.
don't have any.
Oh yeah.
Yeah.
Responsible for.
Oh, super fancy.
Exactly.
Yeah.
And to more than just function, it's so easy to be like, no, I'm at the
And I
baseline of
feel
what
like
I can
people
do.
might be more understanding now, I hope.
Oh
But
really?
Before it was just like, no, there's no way. Like, there's just no way to do this. But now my son's in kindergarten now, so like, he's away. He has a schedule.
We need more pockets inside our jacket.
So I've been thinking about it, but
Yeah, like recommend. I know. That's lame.
I've been for profit now, and it's like a little bit.
it's a little more
It's
corporate.
different, yeah.
Yeah.
Numbers.
Luckily, most of them do. So. Hi, Jessica. I'm Eileen. Nice to meet you. Thanks
But
for
yeah, I've
coming.
thought about
It's
that.
really important.
I really appreciate
Thought about
you
moving
being
to
here and
editing,
talking
just
with
'cause
us
I'm
about
like-
this. Thank you.
I'm done writing. I have a lot of ideas that I'd
Wait,
rather
you might
other
actually
people
have
write.
a.
Oh yeah, oh, she's brilliant.
We're like.
Yeah.
First day, she already had one.
I'm sorry.
Thank you very much.
I have one, I think. I should.
Mystery stuff.
Yeah, no, I don't know. It's I just thought about that because that was very,
Yeah, I mean, I don't.
but in a way it was great.
Thank you. Yeah.
Yeah. I mean, I used to have a job, like a 9 to 5. And,
Yeah.
But it was like one of those like all day. You get home, you check your email, like It's sort of
I love your shirt.
I couldn't do
The
that
bright
now.
colors are lovely. Thank you. I love to.
Yeah, like I said, he's in kindergarten now, so it's a little bit different than when he was in like preschool, like half day, and you have to go to daycare and have all
That
this
was part of the
running around.
reason. So I was like, I love. I usually have the curtains open
Hey,
so I can
Eileen.
watch the sun divorce me get up, and I was like, oh, this
Okay.
I'll be, anything you call me, I'll be okay with. But
Okay.
a doctor's okay because that's a way of identifying.
Yes, exactly.
Who was
the
that guy?
difference
Who was
between
that guy?
right.
That's
the
right. And I'm also seated at the end of the panel, which is right.
Okay.
But-
Actually, might talk.
Yeah.
Yeah, ask you to talk first.
And then you get off at like 3.
Okay,
We'll
doesn't
just have
matter.
a
Yeah, it's
conversation.
okay. It's okay. Any way you do it. But
Wow.
but help me get off stage because I'm a chatty guy.
Oh,
right?
okay.
Okay, and declarative sentences are not my forte. So I work on that. I know that.
Okay, yeah, no.
And also, as I said, I'm sitting next to Jessica.
Okay. Oh, really? Okay. Oh, sure. Yeah. Is that better? Okay. All right. Okay. Okay. Yeah. All right. Good morning. Hello. Welcome to the National Press Club, the place where news happens. I'm Eileen O'Reilly, and I'm a managing editor at Axios and the vice president of the National Press Club. I'm happy to be part of these discussions today. It's a very important topic. I want to take a moment to thank Project Healthy Minds for teaming up with us to bring this event to life. For anyone who doesn't know, Project Healthy Minds is a Millennial and Gen-Z-driven nonprofit. It is focused on tackling the growing mental health crisis by destigmatizing conversations and providing access to a bevy of mental health resources. I'd also like to thank FGS Global, which is an international strategic communications firm that brought Project Healthy Minds and the National Press Club together to create this event at addressing the issue of mental health wellness in the workplace, including newsrooms. This has been part of the firm's pro bono work for its commitment to mental health. Before we get started, there's a couple of housekeeping notes. First, we are recording this session, and it will be posted on our YouTube channel, National Press Club Live, sometime next week. So if your newsroom colleagues were unable to be here in person, please share that link with them, because this is an important topic. Second, if you have a question, there are note cards on your seats. Please write your question on the card and pass them to Kate here in the room. I will try to get to as many as possible. Kate's right over here. Today's first panel is on newsroom fatigue, navigating the 24/7 news cycle. This topic is near and dear to my heart. I know from my own personal experience and from what my reporters at Axios tell me, that the past 5 years or so have been tougher than ever on our well-being. In some ways, journalists thrive on the deadline pressure, competition, and the drive to dig in and expose the truth. All of that can be stressful, but in a healthy way, as long as we can turn it off. But take what is essentially a stressful job on its basic level and top it off with traumatic events many of us cover, from deadly events like hurricanes, the January 6th insurrection and mass shootings, to longer-term wars in Ukraine and the tensions in the Middle East, to justice movements around Black Lives Matter, anti-Asian hatred, and LGBTQ+ rights, to the pandemic that's dragged on for 2.5 years and killed almost 6.6 million people around the world. And on top of that, we're barraged by increasingly malicious social media trolls, and our news cycle is 24/7. It's hard to turn off. So I'm exhausted just thinking about all of this. But hopefully by the end of these 2 sessions, we will have had a great conversation, and hopefully that will lead to some forward-thinking ideas. I'm very excited about our first panel here today. We have 4 amazing journalists and a psychiatrist. Melody Schreiber is a freelance health and science journalist and columnist at the New Republic, a frequent contributor to Guardian US, and the DC correspondent for Arctic Today. Orion Rumler is a reporter who covers LGBTQ+ issues for the nonprofit newsroom 19th News, which is at the intersection of gender, politics, and policy. He's also a former colleague of mine from Axios. Trisha Zengerle is an award-winning journalist for Reuters, currently covering foreign policy and national security issues in Congress. She has reported from more than 36 countries over more than 3 decades. Jessica Washington is a senior reporter at The Root, which says it offers Black news and Black views with a whole lot of attitude. She covers the intersection of race and gender issues. And Dr. Raymond DiPaolo is an active clinician, researcher, and teacher who's authored several books on depression. He's currently a professor at the Johns Hopkins University School of Medicine and past president of the National Network of Depression Centers. Welcome, all of you, and thank you for coming. Dr. DiPaolo, I thought we should start with you, actually. You heard me list some of the stressors that journalists can face. What can that do to our mental health and well-being?
Give me the first part of the sentence again. You said.
Oh, well, you heard me talk about a lot of the different stresses that we face. How can that affect our health and well-being?
Well, right. For all of us, but yes, for the press too. And probably this is the first time I've focused on that.
Yeah.
It affects it in a lot of ways. We all have, we're all made up of various different combinations of chemicals, and our brains are all different. It's remarkable that they look so much alike, and so it affects everybody. And so stress biology now is a big part of medicine. And yes, it does relate to diseases, and there are diseases that fit on this paradigm, anxiety and depression particularly. And that's where I am, but I think that whatever the vulnerability is and your chemistry is, when you get hit with stress and too much stress. I mean, stress is good at the lower levels, okay? It means you're doing something you care about, right? But when it gets a lot and overwhelming, it's very bad on everybody's health. And that's not just your mental health, but it's also kind of your metabolic health and what's going to happen to you later, right? It enhances various inflammatory things, and it's just not good for your health, okay? So that's the main thing. And by the way, I do think that, as I said, I was going to comment that I'm sitting at the end of the table here, and that's where I should be, because this is mostly about normal experiences with stress.
Right, yeah. Yeah, so it can impact a lot of
sort
our...
of normal, sorry.
Yeah, it can impact our entire bodies in certain ways, and yes. So let's turn to our 4 journalists. Can each of you share one event or movement that you've covered recently where you were presented a challenge to your well-being or mental health, and maybe talk about how you were able to handle this or what you learned from those experiences?
Hi, everyone. I'm Melody Schreiber. I'm a woman wearing a black sweater and a black and white skirt. And I am a health and science journalist. I cover climate change, reproductive health, mental health, and most recently, infectious disease and the COVID pandemic. It is incredibly stressful to live through a pandemic. It's also stressful to report on a pandemic, but when you're doing both of those at the same time, it hasn't been fun. But I think how I've dealt with it, I think I actually have obsessive compulsive disorder, which is why I got interested in health in the first place. But that also means that when I'm reporting on like the latest science, my little OCD brain is also calculating like what's the risk here to me. And one of the upsides to doing all of this work is I found a specialized therapist, and that has helped tremendously. It has helped me do my job better, in addition to improving my own health. And I think that's where I'll stop there, but if you have any more questions.
Yeah, of course. Yeah, I was doing some coverage of the pandemic as well, and it was just like, it just kept going and going and going and going. It's like, it's never ending, and it can be very hard to cover something.
I started reporting on it in early January of 2020, and it was really hard to see this coming.
Yes.
I'd reported on global health for years, but to sort of see what's coming down the pike. And right now I'm working on a what's next piece, and so as soon as everyone else hits a lull and they kind of relax, I'm thinking, okay, what's coming down the pike?
That's right.
And it's hard to turn off, and when I log off, then I'm worried about my own personal issues. So it really is 24/7.
Yeah. Well, thank you for sharing that. Ryan, how about you?
So I cover LGBTQ news most of the time, as Eileen mentioned, and I think this year the most challenging story that I wrote was also the one that I think is the most important story that I've written. It was about, I spoke with 8 LGBTQ adults and 2 trans teenagers about there are suicide attempts and there's suicidal ideation, but with the intention of like, how did you come back from that? How did you decide to keep living? What kind of support did you have? Like, who helped you come away from that? And it was different responses from different people. A lot of it was like, I had this one person in my family who understood. For one woman, it was her mom, who had also experienced strong suicidal ideation, and so they had a really close relationship about it. And I was really proud of that story because we know from the data that so many LGBTQ people think about suicide very seriously, and it doesn't get better the younger you go. It actually gets a little bit worse the younger you go, which is terrifying. So I wanted to do something with that data that could maybe offer people something, like anything to take away, like, oh, this is how this person found hope. Like, maybe I can make it. So I knew this story was going to be hard. I was really happy to write it, and I was grateful people wanted to share. I don't know if I would have shared that with anybody, but it was really rewarding. And then the really difficult part came later when I learned that someone I'd spoken with had later attempted suicide again. And of course, I have no control over that. And I think it made me realize, like, oh, I have a very strong, like, I expected, like, oh, I thought, like, I could help this person. I thought they were okay. Like, I thought, so anyway, that was so difficult to me because I think part of why I do this work is, like, I have an expectation that I can, like, help or change anything. And I think that's what a lot of journalists, like, we want to do. Like, we want to exact change by, like, giving people information, by, like, showing them the truth. We think something can change or benefit as a result of that. And I was like, oh, I couldn't do that for you. But so anyway, the point of that has been for me to realize, like, I can't, like, I cannot be responsible for how someone does for the rest of their life after I absorb their story and just carry it with me for the rest of time. I cannot control what happens to them after, which is, anyway, so that's been, like, my journey of learning. So I'm really grateful to talk about this.
That's a really tough thing, so, but thank you for sharing that. Yeah. Okay. Tricia, how about you?
My story is that I was covering the Capitol the day of the January 6th insurrection and found myself, I was one of the people who was in the House chamber when the crowds were outside and heard the shots and they were banging on the doors, and it was terrifying. And I think it was more terrifying because I've actually been in war zones, and for example, I went to Haiti right after the earthquake, and I covered a bunch of hurricanes during my years in Florida, et cetera, but it was different because it was the Capitol, right? That's where I go every day, and the morning of January 6th, I have these text messages I sent to my worried relatives saying, I'm safely inside the Capitol. It's one of the safest buildings on earth, which a bunch of us being reporters I know, sent. And that was more, I think, disturbing. I know it was more disturbing because it was a place that it was so different, right? I think it's probably akin to if you live in your house and you live in your home and it's invaded, and then all of a sudden you don't feel safe at home anymore. And I did the same thing, was there all day covering the election. Also, democracy. What does this mean for our country, our democracy? It was on so many different levels. Disturbing. And then for my personal safety, that was upsetting. And then to see the signs, the graffiti they'd put up that said "Murder the Media," or one of my colleagues was personally attacked outside. He's a black cameraman, and they didn't attack the white guys on the crew, etc. So there was a lot of stuff. And I, like everyone else, found myself at 2 or 3 a.m. in the days after doom scrolling on the phone obsessively. And I'm lucky I work for a global news organization that has a lot of resources. And I've taken advantage of them. I have an excellent therapist who was referred to me by the company. We had some group chats with people all over the world. We have a peer counseling network, a couple of whom didn't even wait for me to reach out to them. They came to me and were like, how about if we chat? How about if we talk? And so taking advantage, that's just one part, is taking advantage of those kinds of resources and the idea that people do care and they are thinking of you. I think that's such a big thing.
Yeah. I totally agree. Okay.
No, I mean, hearing your story, it's very harrowing. I'm glad you're here with us. Yeah, I think for me, I tend to speak to people about the worst days of their lives, and that can be really, really challenging. I think especially when you cover gender and race, what you find is that gender-based violence is such a thread through every issue. You can think you're covering the criminal justice system. You can think that you're covering child welfare. And what you'll see is that throughout all of those systems, domestic violence, other forms of gender-based violence are so prevalent. And I have found that personally very triggering in my coverage, but also really important, and really important to talk to folks who feel that no one is going to understand them, no one's going to understand their choices or why they've done the things that they've done. And to be there has felt really, really important to me, even if I notice afterwards that I don't feel like myself sometimes. But one thing that helped me recently was talking to a source who mentioned, she's going through a lot, and had mentioned that what she really needed was people to be strong for her. She needed to make sure that we weren't going to break down or put her pain on her. And she wasn't referring necessarily to me, but it made me rethink the importance of taking care of my own mental health, and why it was so important to not put that burden on my sources, that they're telling me about their worst days, not my worst day. And even if it's hard to hear, it's more important to listen. And so I think that's really been a shift in making sure that I prioritize my well-being mentally, have people to talk to, take exercise breaks when I need to, things I know help. And I think that's been really useful as not just a thing for me, but a thing for the people that I cover.
Yeah, that's really important lessons for all of us to think about, for sure. All right, Dr. DePaulo.
I'm thinking maybe I am where I need to be.
Okay.
All of you. Those are amazing stories.
Mm-hmm. Do you have any, so can you tell me more about like how your companies have supported you through all of this, and like what you found that might be working, and what you wish could happen still?
I'm glad to share. So for me, I know the day after I filed the story on suicide, I just took the day off. I was like, I need to not be here for a bit. I need to decompress. And they were like, yeah, absolutely fine. Because we can take personal days, and we don't have to explain, like paid personal days, we don't have to explain like what's going on. Mm-hmm. And a lot of people use those as like unofficial mental health days. And I know Axios and some other companies, like they have official mental health days, mm-hmm.
Mm-hmm.
Which is very good. And for us, it's that. And then something our head HR people ops person, Jaya, who's excellent, he mentioned recently, like we, at one of our weekly news meetings, we have like a meditation mindfulness moment, which is optional. You don't always have time for it, or to stay for it. But I thought his was useful because he was talking about how to close like stress cycles or like stress loops. Mm-hmm. And he was recommending a book we should all read about like closing stress loops, and he was like giving advice that was helpful for me about how to like end a stress cycle, because it was like you need to do something physically to like let stress out, if it's like exercising or having like a really long hug or like creating or doing art. And I've done all of those things to help come back from stress, or like to physically let it out. So that's been helpful for me. So basically, flexible paid time off at a company is very good. We also have therapy discount that we can get, has been mm-hmm. helpful for me. And I think the other most important thing that is less of like a mandate that a newsroom can do and more just about the people you have who can give you support. But I know I've gotten really lovely calls from a few like editors and reporters at the 19th who've reached out unprompted and be like, how are you doing? Like, are you doing okay? Like, are you actually okay? Which I think can be great for journalists because I think sometimes we have like a stiff upper lip going on and we like don't want to talk about it.
That's true.
Right. And something one of my colleagues was saying, she was like, it was basically like there's no benefit to like pretending everything's fine. Like you're not winning anything, you need to talk about it. So that was helpful.
Yeah, I agree with that. Anybody else have thoughts on?
I took advantage of, as I said,
Yeah.
the therapy referral. I do not participate in this because I like to exercise with strangers, but the company offers yoga classes. And the company also offers art classes, which I don't do, but one thing that I did personally, I'm glad that those things exist, and one thing that I did personally is after the events of January 6th and surrounding the inauguration, because all of a sudden we all remember we were living and working in DC, that was like a giant war zone. I had to walk like a mile from the edge of the cordon to my cubicle.
Yeah.
But I did work with some of our security editors. I don't really know how to describe their titles, but they're people who are in charge of security to get lists of hotels where people could call to stay, I think car services, and putting some other mechanisms in place to make sure that this is who you can, if there is a situation like this again. And that was very good for me because it felt very proactive, like coming out of this, it was an effective change in some policies. And that was a very good positive for me.
Yeah, I've had an editor relatively recently who was very clear on making sure I took days off. I tend not to take too many days off, and she would always say, you've got to take the time, especially after a tough story, or she would always check in after that and make sure that I was doing okay, just consistently. And I think having an editor who is also feels like a friend and a mentor makes it so much easier to go through these stories, knowing that you're not alone, knowing that someone is there with you and cares about you as a human being and you as a journalist. I think just makes all of the difference mentally, and knowing that there's someone pulling for you in this industry is invaluable.
I'm a freelancer, so I don't really have a job. No, so I don't have any institutional resources available to me. I have editors who can offer their personal support, which is great. I only work with editors who understand if something comes up or if I'm having a rough time. If someone isn't giving me adequate support, then I count that toward like a relationship of like, is this still working for me? So the editors I work with are all amazing. But I don't have health insurance through work. I have it through my spouse. I pay out of pocket for therapy. I don't have any of the institutional stuff, but I have great friends. So recently I received like a graphic DVD in the mail to my home address that was because of a story I wrote. So I immediately contacted my editor, who sent me to the top editor at the organization for the story I'd written. So they opened like an inquiry into that. I spoke with friends and got on services like Delete Me to reduce my exposure of my private information. So that's something. I've also worried about sources, mental and legal well-being, and so speaking with editors about that can help. But often I do feel a little bit alone out there. Like, I might turn in a story for this editor and they say, great, that's awesome, like you did a great job on this, like take some time. But I already have a deadline from this editor who doesn't know about this story. And so I really have to advocate for myself, which I often do poorly. I don't take a lot of time off, but I should. But recently, not too recently, I had COVID, and I didn't get any paid time off for the whole time I was very sick. And I've had a very long recovery. And that's been really hard, actually, because I haven't been able to work, which is worrisome for my budget, but also for my identity. And so it's really been an experience where I'm trying to come back and figure out what matters to me, what kind of work do I want to do that's worth the effort, because I have a lot more fatigue. And that has actually been a really clarifying experience as well, about thinking about like, how do I reach out and find the support I need right now, and like tell editors like it's not going to happen today,
Right.
And advocate for myself when, you know, what am I to them, you know? It's been a great, actually, it's a learning experience for me to kind of put myself first and try not to worry about my bills, and to seek out the support that I need. So that was long.
Yeah, I used to be a freelancer too, so I know your pain. Like, it's definitely a difficult thing. It's got great pros and cons for sure.
I
But
love freelancing, but
yeah, I know.
the support is the hard part.
Yeah. Well, I hope you know the National Press Club is here for you. There's a lot of freelancers in our membership, and you don't have to be a member to come and like, you know, like enjoy some of them. So just reach out to me.
Keep that in mind, yeah.
Dr. DiPaolo.
I was just going to say that we've heard a lot of, actually, I was talking to Jessica earlier about Jessica's rules, but they're good. And I think you could take the items that Ryan said and Patricia and everybody. So first off, people mentioned all kinds of things, and I thought that one of the things about time off was it's not just time away, but sometimes doing, you know, the word recreation literally means recreation. So find those things that you love doing that really aren't stressful, or if they have their little internal stress, they may be competitive, a game of whatever, canasta from the tennis or golf, are really helpful, and because you are able to get out of it, you know, something that'll, I used to say that I could, you know, if I played golf, 10 minutes away from my work, I wouldn't remember during the middle of it what my job was. And that's a cool thing. But that's one thing I would say. I think the other thing that people mentioned therapy is that I was saying most people that come to me think they're coming too early and kind of half apologize for being there. And they're having a lot, and so my rule is get into therapy a little early, please. No one's going to criticize you for doing that, at least not in the profession. And because it works better then. When you get too overwhelmed, you then stop making decisions as well as you normally would. So those are a couple of things, but I think, you know, we can make a nice little list, and I have a nice little list now for anybody that wants. That does fit very well into how you do take care of yourself. The one I liked from Jessica the other day very much was, and she's talked about it today, was take care of yourself first and outside the workplace. But it is also good to hear that at least 3 out of 4 organizations have resources. And that's not the way it was 10 years ago or 15 years ago.
Oh, I totally agree.
Yeah.
Totally transformed.
I also think there's a culture within journalism of you might have the time, but are you encouraged to take it? Do you feel like
Absolutely
you can
right.
take it? Like, not just, you know, for me it's a financial concern, but it's also like if you are out, if you sit this one out, are you going to be out forever? You know?
Absolutely right.
So knowing that, like, no, you'll get back in there. Like, if you do this now, it's kind of like an investment in your ability to continue doing this work.
Absolutely right. And well, that's right. On the airplanes, they say put the oxygen on yourself first and then help others. Is my little way of capturing that. But also, you know, there is a book now written by the guy who started Netflix, and he said it's very important for the CEO to take vacation time and tell people he's going on vacation to set an example.
Yeah, I think these are great. Fantastic. I think, you know, another thing is like, so there's ways to, when we're reporting, to think about like how to protect ourselves. Like, you can do it before you cover anything, like if it's something you know is going to happen. And then you have to process things while you're covering something. That's another way where you have to be secure in yourself. And then afterwards, how you process that trauma or potential trauma is another thing that you have to worry about. So I'd like to talk a little bit about like what we can do before, like if we, like before you're covering something that you know could be traumatic. And I think one of them might be like how to set boundaries and, you know, tell your team that you're not going to do certain things. Like, like maybe a cameraman wants to go closer to the action or something like that, and you're like, no, I'm not comfortable doing that. So, do you have any thoughts on like ways you can, you know, like go ahead beforehand to protect yourself?
Do you mean mental health or just physical health?
I think they're connected. I mean, to me, they're connected. So both, but.
Well, I think one thing that people need to remember is that you should be, and we've talked about this, you should not be afraid to advocate for yourself. And there's nothing wrong with it, and you're not weak if you don't. And I have one example, just came to mind. I was on assignment again in Haiti after the earthquake. And a lot of my colleagues were being ferried around Port-au-Prince, the capital, on the back of motorcycles. And I came in and I was like, oops, I keep knocking over the water bottles. I was like, I'm a middle-aged lady. I'm not going to do this. And I felt a little sheepish, but I said, can you get me a driver with a car? But another advantage of it was when I was sitting in my car, because we had internet, and this was 10 years ago, so it was a BlackBerry, I could file, which is when, especially being a wire service reporter, that's really what it's about. It's not being a cowboy on the back of a, and one of my colleagues fell off and was in, and had to be, of the bike, and had to be, get medical attention.
Oh, wow.
So anyway, that's a little, but I think maybe the mental health piece of it is you have to be, you can't be afraid to be your own advocate, and it's okay. And I do think, again, talking about how things have changed, I think that now it's easier to be your own advocate that way. So that's one example.
In general, I have a firm no motorbike policy. Especially having reported on health, like you go to the hospitals, you see what happens.
They didn't have helmets.
Yeah, no. The only time I was in the Nepal earthquake, and my fixer said it is much safer on the motorbikes because of all the rubble and because of the earthquakes. So we can exit the motorbike faster, and he promised to be safe. That's the only time. I think that journalists often have this idea that like I'm not the story, I'm just telling the story, and so we see ourselves as kind of like a vessel for other people's stories. At least that's how I do. Like, you know, all I do is I sit at home and I call people up and then I write down what they say and then I put it in an organized way and I send it off into the ether. And so you think like they're the ones who need the attention, they're the ones who need the help and the resources, but you don't really realize the toll that it takes. So I think knowing ahead of time that something that you're going to report on will not just be hard to manage professionally, or like knowing that you need to walk into this like working with your sources on like how are they doing, are they prepared for this, checking in with them, like are you okay, but also like having a plan for checking in on yourself. And one of the things you mentioned, the pandemic seems to go on forever. I think one thing that has helped me is I didn't go into it expecting a certain end date, and I think that has helped, because when you kind of see that something has gone off the rails, can be a very stressful thing if like, things are not going the way you planned, that can help. So sort of like having an openness about where things are going can also help with your stress levels, if that makes sense.
Yeah, totally does. Yeah. So you know the virus, you know, how it spreads, and just can't control that stuff, so, yeah.
And I love talking about this, and y'all's tips so far are helping me as well. And when you mentioned, Eileen, setting boundaries, I think for me one of the most important boundaries is to like set with myself internally, and it's about like how, like I have to remind myself like I can't let this person's story that we're taking on, like I can't let it linger. Like it probably will, but I try to tell myself not to do that, and I think this is the strongest whenever it's someone, like Jessica mentioned, like telling me something they've told nobody else, probably the worst thing that's ever happened to them. And I think particularly when they've told like nobody, when like once they get the opportunity or the chance to like talk about it, just like walking, especially when it's a trauma, they usually need a little bit of help, like revisiting that trauma and telling it in an organized way, and they need, like in my experience, it's been like, okay, I'm going to like go with you into this traumatic memory, and I'm gonna help you untangle it, and we're gonna like walk through it step by step, and I'm gonna try and like help you remember things that you have tried to forget. But I usually preface these kinds of interviews with like, we can stop at any point, like come back to this, we don't have to like talk about literally everything right now. But for that kind of interview, I think that's one where I try to like give myself a pep talk beforehand, like, okay, you're gonna get in there, and then you have to get back out. Like once you hang up the phone, you're going to step away, you're gonna physically go outside, you're gonna like maybe see a movie, like see a friend, like do anything so that you're not saturating yourself in there for the rest of the night. Because I've done that before. So.
Yeah, it's very hard to turn off. That's really smart to do that. So,
Thank you.
good.
I don't know, one thing I think, and it just, like doing this now, talking about it, I've realized this is what I do, and I didn't think about it. I try and get somewhere really comfortable. I don't do my serious, really, really difficult interviews at my desk. If I'm home, which I would prefer to be generally when I'm doing these kinds of interviews, I tend to do them on my couch. Sometimes I do them walking around. I pace when I get nervous or anxious, and it just makes me feel a little bit better. But yeah, I do a lot of it just in a comfortable position. I try and make it feel like as not even casual as possible, but as relaxed as possible, as much as we are in your home, as much as I can get as close to feeling as if I'm in someone's home, which is also when I tend to feel like the best interviews happen. It's kind of when we're in that space together, we're comfortable. I try not to make it so intense. If I'm sitting at my desk, I would treat it more like I treat interviews with experts, and those are really different. So I think I tend to do that, or I tend to go into, if I'm in my office, we have like little nooks and stuff I can go into, and I tend to do that. And you know, if I can, I put it on speaker and just keep it where I can near me, rather than, I don't know why, I think maybe having it in my ears directly would be different, but I just try and get as relaxed as possible in these conversations before we go in. And yeah, I think pulling yourself out afterwards is very, very difficult, and I don't think I've mastered that at all. But I think that helps a lot when I know it's going to get heavy. It just getting as comfortable as possible beforehand is useful.
I'm going to try that. That's awesome.
Yeah, I didn't realize I did until we started talking about this.
Yeah, I love that. That's really awesome. So, yeah, and I feel like that's something that we're constantly working on, like how to separate ourselves from our subjects. And
I will add that
Yeah.
I think the workplace, as I've generally said to my patients I'm treating for depression, yes, stay at work if you can, because work can be a very therapeutic place, except during a pandemic, right? Which none of us thought about, right?
Why?
Because it is, because you're with people that you know and who know you can do your job, and are going to want you to do okay. I've talked to many employers, you know, when patients are uncertain if they should talk to their employer, and one said, "Go ahead, you talk to him." And I asked him, "Well, what are you concerned about?" He says, "Well, I just want to know, one, are you okay? And two, is there something I shouldn't talk about? Because I don't want to trigger you in some way," right? Mostly they don't want to know the gory details, but they want to know that you're okay. And so that's very, you have those people at work all the time, and you want to use them. And when my patients go home, and sometimes their husband will say, "Well, here are the kids, and there's the kitchen, and also, you know, but you can skip work." And I say, no, you got it all wrong, Dad. She should go to work, because that's a good place for her to be most of the time. I think during the pandemic, like I said, a bit of a wild card.
Say like work where you feel safe. Working where you feel safe.
Yes.
Or
absolutely.
like
Yeah.
structure,
Yeah.
support.
Safety should always come first, for sure. There's a couple of questions I thought we could go through real quick. What role can news consumers and audiences play in supporting a healthier and more sustainable news ecosystem, particularly in an online environment? Which I think is interesting. So
That's what news consumers can do.
our audience, like,
I think if you're able to pay for journalism, that's a really good
gonna
thing to do.
Subscribe and follow.
that's right.
Like for our own self-interest, obviously, but also like I think if you can support newsrooms that are creating like longer stories, and it's like the Axios style, like y'all do in-depth stories, so it doesn't have to be literal length, but just like deep. If you can support deep reporting and a newsroom that's able to because I don't think you can have really in-depth reporting if people aren't being supported.
Yeah.
At least not consistently. So if you're able to pay to support those newsrooms that are putting out like in-depth stories, especially ones like the ones Jessica's doing, where it's like talking with someone about like revealing really bad things that have happened, I think that's a way to support.
Also, I think just like writing in when you see a good piece, like commenting with positive feedback, because a lot of times the feedback is, it's not actually feedback, it's just trolling, and it's good to get some positive feedback when you see it. So
I was gonna say, anytime you see an article you like, please write
yeah,
and say
yeah,
thank
it's
you,
very
because
helpful.
most of the mail is not as positive. And then for me, it's always nice when like my editor gets an email about it, if it's good. If it's bad, you don't need to tell them. But also like that kind of reinforces that this was valuable work for you, because a lot of times I guess editors just work on like metrics, So,
Yeah, that's true.
Yeah.
I'd also say try not to spread, I'm not sure, I don't think anyone here would, but disinformation, including if you're on Facebook or another platform and you see somebody spreading something that just isn't true, be that nerd, be that friend who says, actually, and give them the thing from Snopes or whatever.
Or if you don't want to be that person, just report it as misinformation.
Well,
Flag it
that's
on the
true too.
platform.
I was thinking more with friends. Yeah, but exactly. But positive feedback, yes. And paying for news, we're all about.
Yes, totally.
Yeah, I was gonna say, definitely positive feedback is nice. Most of the things people comment are not very nice. And I really, the name calling in the comment section and I'm sure all of us have received some kinds of threats. Those kind of stuff is, it's terrifying. And especially, when you start off in the industry and you start seeing that, the better your pieces do, the more people dislike you online. It just kind of happens. But yeah, those positive comments really make you feel so good, because you'll have a comment section where people are tearing you down at just that one person who is like, here, this article is really good, or just something just kind. I think, I don't know, it seems odd, like you don't think that journalists are reading what you write in those comment sections. I think people must not think that, or they wouldn't write some of the stuff they do. But it means a lot. It means a lot to know that the journalism matters to folks, or sharing it on Twitter and on social media. That's also really helpful. Even critiques that are based in something real. I really actually appreciate hearing from folks like, I did a story recently, and I was doing it quickly, and I didn't include one of the a group that was included in the story the story was focusing on. I didn't include someone from one of those groups, and someone called me out on it. And I really appreciated that, because although I'd been doing that story quickly, I hadn't, it wasn't intentional. They were like, hey, you didn't have someone from this community. I think they should be represented. That means a lot. It makes me better as a journalist when I get that kind of constructive advice from folks within communities that I want to cover and I want to do right by. So I think, doesn't always have to be like just nice, but constructive critiques are useful. Journalism's hard, and it's good to have that feedback.
Yeah, constructive, and also sometimes someone can say something that can give you an idea for your next story.
Yeah, I was just gonna say that, like, write in if you do see something like, I like this, but this was missing, or even like, I didn't like this because this was missing. Like, that can be the next story. That can be like, can reformulate the way.
Or I saw you did this.
Yeah.
Did you know about that?
Yeah, that's an awesome resource for journalists too.
Absolutely, totally agree with that. And then I think we have time for one more question. So many reporters, especially early career ones, are working to prove themselves and keep their spots in a tough industry. How do you have any recommendations on how our newest journalists can, like fight for their spot in our very competitive industry and still, retain their mental health and well-being?
I could say one thing you can do is you can get skills. Learn some languages. Get comfortable with economics. Get comfortable with business. Don't get tech skills. Be a total package. Don't go too crazy. Obviously, you can't be all things to all people, but especially when you're younger and you're starting out. And even when you're at university, you can say, hey, I'm gonna learn Spanish, or I'm gonna learn another language that's very, very useful. I'm gonna get, if you want to be, I'm gonna get some experience living in a country that's not typical of where I live, a developing nation, or the global south, or whatever we call it. Those are a few things that you can do that are more realistic and can really make you stand out from the crowd.
It's true.
I would say that people who tend to stay in this industry aren't necessarily the people who are like the very best. They're the people who stick with it. Do you know what I mean? Like, ideally, you're both, right? But it's the people who are able to find a pace that's sustainable. You might get an opportunity and you're just like, oh God, I don't want to blow this because this could be my chance. But you need to make sure that you can actually fulfill what you're doing. You need to be able to tell the story correctly and deliver to your editors on time. So you need to know what pace works for you that's not going to make you burn out. People are like, I love being passionate about work, but it's also like thinking of it as work, as a business. If you really love this and want to stay in it, you need to be thinking about that from the beginning, about how not to flame out.
I love that. I also love Trisha's advice on like learning skills, but I think that's a really good point on not burning out. Like for students or early career journalists, I think that's really important to, like, you don't have, like, it's okay. Like you don't have to do everything immediately like when you're starting, because I think when you're super new, and this is something I was talking at students earlier this month, is like when you're just starting out, I think that's when a newsroom will like try to take advantage of you, because they see that you want it so much, and they will see that and they're like, okay, we're gonna use that up. We're gonna use that. And I just, like, I try to warn students, like, it's okay to set your pace when you're starting out. Like, you have so much time.
Yes.
You do not need to go super hard right now. Like, you can take time, like, learning skills, like Trisha was saying. Like, you don't need to say yes to every little thing. Because I think that's how it's easy to get taken advantage of, if you, like, instead of like picking and choosing the projects you want to say yes to, like, intentionally.
Yeah, I also know, like, essayist or something. Like, a lot of people, like, there was the, like, it happened to me, like, trend, and only share what you're willing to share. Only do the stories that you are willing to do, and, like, set those boundaries of, like, this part is off limits. There are things I won't ever report on, because I know that is, like, the fast road to burnout for me. And that's a privilege, right, to be able to say no, but it's also, like, really important if you want to stay in the industry.
No, that talking about, like, setting those kinds of boundaries is so, because I think, like, there are stories that do well because they're controversial, or because, they're the opposite of what you might think, right? And so there will be editors that will try and push you to do those stories, and they are not totally accurate all the time. Like, anything, all of those things. And so it's like, okay, pushing back because you know what you're reporting on.
Yes.
At a certain point, you become an issue area expert, and so you understand the issue, and you need to be sure that you're not tarnishing, and I hate to use the word brand, but, like, it is your reputation. You need to be careful about your own reputation, and, like, not do stories that you can't stand behind later, just because that person is paying your bills right now. You have to, we don't have a journalism board of ethics, or, like, an ethics exam like attorneys or, like, doctors. You've got to be able to hold your own ethics and hold yourself accountable And I think that to me has been so important, especially when I was even earlier in my career. And the other thing is just finding an advocate. I wouldn't be anywhere I am today without the amazing editors and bureau chiefs and folks that I'd worked with that have been so supportive. And I think finding those people, I mean, partially it's luck, right? Like, you just happen to find them. But also it's cultivating those relationships. I still call people that I've worked with 4 years ago and just check in. Every person that comes into my life that I feel like has something to offer in terms of advice or comfort or that kind of stuff in the industry, I hold on to for dear life because they're so useful, either as a resource or someone to push for you in the next job. Each job I've gotten, it's a large part because someone pushed for me at my last job who said, I'm going to be your, reference, or I know this person, you should go on, you should work with this next person. I think it's like invaluable to have someone you can rely on.
Yeah, I totally agree. These are all great points. All right, Dr. DePaulo, any words of wisdom as we
Well,
close
I'm
out?
just going to say, I think it's been a great discussion, and I
Yeah.
think people have given the right, I hope a lot of journalists are either here or going to watch this, because I think these are the right ways to look at things, and I don't think I have anything brilliant to add.
Well, thank you for everything. All right, since we're almost at the top of the hour, I want to quickly thank our panel of journalists and our medical expert. We appreciate your thoughts and perspectives and hope these types of conversations will continue into all newsrooms. Before we start our next panel, we're going to take a quick 5-minute break, and we'll be back here shortly. Thanks.
That was so much fun. So good to see you. It's good. I was in Chicago earlier this month for the NLGGA conference, which I love so much, because in 2018, like basically when I met Ina and like how she got me at Access, like I was one of the students in their little program. Yeah, and I was one of like those students, and then they were like, you should meet Ina. And so this year I got to be one of the mentors for the students. And so I got to be that person who's like, go, go.
Now you're like, I know the feeling.
I got to edit 2 of them, and anyway, it was fabulous. I loved it. So good. How are you doing? Me too. I'm excited to catch up and actually spend some time. Yeah. Thank you for putting this together.
new to the room and the discussion, I'm Eileen O'Reilly. I'm a managing editor at Axios and the vice president of the National Press Club. Now that we've talked with the journalists who cover the challenging stories, often to the detriment of their own well-being, we want to shift now to discuss how newsrooms and boardrooms are managing new expectations from employees and how companies are responding to the shift in the workplace. I'd like to introduce our new panel of subject matter experts. Andy Dunn, here to my left, co-founded menswear brand Bonobos and served as CEO until its 2017 acquisition. As an investor, he has backed more than 80 startups, and his next business venture is called Pumpkin Pie, a social media app that will aim to create more genuine human connections. Another point of interest is that he recently released a memoir called Burn Rate, Launching a Startup and Losing My Mind. That sounds very appropriate given today's topic. Anna Johnson is the AP's Washington bureau chief, where she oversees the outlet's coverage of the federal government politics and elections in the US. She moved here in February this year from London, where she was the news director for Europe and Africa, overseeing coverage of Brexit, Russia, the war in Ethiopia, and the COVID pandemic. Just a couple, little stories. Phil Schreiber is the founder and CEO of Project Healthy Minds, a Millennial Gen-Z-driven nonprofit startup focused on tackling one of the defining issues of our generation, the growing mental health crisis. Project Healthy Minds is creating the world's first digital mental health marketplace, as well as the first national standards for businesses to better support employee mental health. And Sebastian Niles is a partner at Wachtell, Lipton, Rosen & Katz, where he works closely with public company boards of directors and management teams. He's focused on corporate governance and strategy, rapid response shareholder and stakeholder activism, proxy fights and takeover defense, and enterprise risk oversight, including in ESG and human capital management issues, as well as mergers and acquisitions. He is co-founder of the Harvard Association of Law and Business. So welcome, everyone. Thank you for coming. Anna, I thought we'd start with you, as we just heard from many journalists on what they've been dealing with. I feel like we've become much more aware of the impact journalism can have on individuals' mental health and well-being since you and I both started as journalists. That's been a big progress. You've been managing and leading reporters through some of the toughest reporting experiences of our lifetime. As a manager of a large newsroom, what are some of the lessons you've learned on how and why mental health is so important, and how we as managers can protect our journalists in this never-ending 24/7 news cycle?
Great question. And yes, I listening to the panel before this, I think there was, it was just so interesting, and I think really reflects, just so much of what we do. I think back when I first became a journalist and first started managing newsrooms, and there was so much. We would think a lot of like the frontline journalists in a war zone or a conflict zone, and we would talk a lot about safety plans. They were physical safety plans. We did a lot of preparation. We have a process in place at the AP, as I'm sure many global news companies do. There's a process in place. You analyze the safety. You come up with plans around it. And we spent a lot of time doing this, rightfully so. We wanted to obviously protect our journalists, the utmost important thing that we can do. I think but it was really around physical safety, and it was really around those like sort of on the front lines, on the ground, the people that were, covering news just, right in front of them and are put in really dangerous situations oftentimes. I think a huge shift has happened over the last several years, and in particular around the pandemic really kind of crashed that forward, where all over the world, we weren't covering many stories, we were really covering one story, and we were all at home, and everyone's both professional lives and personal lives just came crashing together, and it was just such a precarious and terrible time, and we had to find ways. People were going through so much, and so much change was happening. And I think we really started to think about, and we started to do these things where we really thought about people's, not just their physical well-being, because we still talked a lot about, we had journalists going into hospitals, ICUs, they had to cover the story and they had to do it safely, just like so many medical professionals did. But we also had a lot of discussions about just how we were coping with this just transformational moment that was scary and awful and, just presented so many complex issues. And I think we really thought of it in terms of having we did a lot of online gatherings about coping. We brought in, a mental health professional, or we just shared among colleagues in a way that we used to do, we're a big global news agency, we're all over the world. So we would have like Zoom calls, like Q&As about topics around the newsroom, like, strictly kind of on news-related things. And this was really the first time, I think, that I can remember that we would bring like the whole newsroom, the global newsroom together to just talk about how we were dealing with things, how we were coping with things, sharing our experiences. I can remember one of these because it had a lot of our sort of just incredible journalists who opened up and shared about how they were dealing with the pandemic, how hard it was, about other things that they've been dealing with journalism, but a lot about their mental health, a lot about the stress, a lot about the burnout. And we just started to share these things more collectively and made us all it really helped. I found those to be some of the most therapeutic things that I did in the pandemic. And you'd have hundreds and hundreds of people joining around the world for these moments. I think it also, since we've kind of gone back to the offices now, we're back in a newsroom, things have shifted. I will say that we've tried to carry some of that over just as a company. Earlier this year, we've had obviously lots of traumatic news events already in 2022. And of course, the war in Ukraine being one of them, and the 2 mass shootings in Uvalde and Buffalo, and then of course then in Highland Park not so long after. And after the first two, Buffalo and Uvalde, the AP brought in a specialist, a therapist who specializes in trauma, and particularly with journalists. Mm-hmm. And we did sessions about anyone who was working on this story. Because I think another thing that has really shifted, and we need to even do this more and more, is it's not just those in the field, on the front lines, it's journalists everywhere. For example, with the war in Ukraine, it's not just our journalists in Ukraine that are covering this and seeing and witnessing, really horrible, hard things to deal with. It's all of our editors everywhere who not only see that coming in and they're dealing with photos and video and text stories from all over on Ukraine, but then they're also shifting the next day, they're covering the shooting in Buffalo. And then the next day, they're covering this. It's also just, journalists dealing with all of this everywhere and thinking really well beyond just those on the ground, that it's all of us having to cover these kind of really traumatic situations in a variety of different ways that can be difficult for everybody, sometimes similarly difficult and sometimes very different. And I know we're going to continue some of these, more, we had a big group session with a lot of people and then very small sessions, mm-hmm. which I think a lot of people found to be really beneficial. This is in addition to sort of some of the other things, the sort of traditional EAPs and that type of thing. But I know that we're going to do more of this and plan to do more of this because the news cycle, as noted, never ends. Mm-hmm. And our journalists are covering such traumatic things. The last thing I'll just note is sort of how I, as a manager who manages newsrooms now in Washington, previous to this in London and elsewhere around the world, I think there's a couple things that I really try to do to just check in on my team all the time. I care deeply about how they are doing. I'm a pretty open person. It's just my personality. I find that I really like having one-on-ones with staff as frequently as possible, obviously to talk about their career and that team, or about a story they're working on, but also just to check in and see how people are doing and to let them know that we're always here when something does happen in someone's personal life or even their professional, to kind of lend that support. Not everybody wants to talk, that's okay, that's everyone's choice, but that they have that ability to, and that will provide the resources. I should also note, amongst all of this, of course, is what we talked about earlier with the online harassment also being something that's been really, just increasingly getting more and more difficult, and more of our journalists are really, really impacted by this all of the time. And then finally, the last thing I will say is about time off. I am a huge, big believer in this. As you heard a lot of the journalists in the last panel, and I know from a lot of my team, that taking time off can sometimes be hard. People afraid to miss the story, always feel like they're going. It's imperative, and I really try to make that as clear. I take time off. And when I took my vacation earlier this summer, I let people know that I was turning off the notifications on my phone, that I would not be looking at Slack or email. I was reachable if there was an emergency. You could call or text me. I think it's really important for people to take their vacation, to take their time off, to get away, because otherwise you just cannot sustain the constant.
Yeah.
Oh, that trip? That I was in Vancouver, and I was in Canada.
Ooh, nice. That's awesome. Leading by example, so I think that's really great. Awesome. And I think like the lessons you just talked about can apply to other companies and other employees as well. So I think it's very important. Phil, when we spoke yesterday, you mentioned how many news organizations and boards and many types of companies are struggling because there's no real playbook out there on this. Like many companies offer EAPs or employee assistance programs. That's sort of like an outsourced hotline offered by the insurance company. But I think you said utilization was between 3 and 5% or something. What do you see is missing in this picture?
Well, I would say, we're in the bottom of the first inning of reimagining the relationship between the corporation and the worker on mental health. I mean, I think, what you have basically over the last 85 years in this country is every company, and it doesn't matter what kind of company you're talking about. It could be a news organization, but you could be talking about technology businesses, you could be talking about financial services businesses, you could have retail businesses. They all basically have shared the same path, which is for 85 years they've relied on the Employee Assistance Program, the EAP, to check the box on mental health services. But utilization rates of those EAPs are between 3 and 5%. Nobody uses them. And for the people who do use them, if you've ever talked to those people, they will tell you that the experience is terrible. And so what you have sort of a convergence of longer running trends, right? Younger people in the workforce who are putting a priority on mental health and demanding more of their leaders, plus COVID. And as a result of that, you had a lot of businesses as a part of the crisis response saying, hey, we've always known, we always knew that mental health was an issue, but now we really got to focus on it. We got to figure out what more can we do. Everybody is struggling. And so what you saw a lot of organizations, a lot of companies begin to just pilot things because there is no, if you look around and you say, okay, well, where's the research? What should we be doing? What is the playbook that a company should be doing? If you think about what a playbook is for a company on an issue like retirement planning, there's a very well-known playbook. You create a 401k. You auto-enroll your workers in that 401k. You use a cash incentive, the match, to encourage people to save for retirement so that when they retire, they actually have something to live off of, right? And companies can choose where along a spectrum they want to be and how generous they are. But there's no question around what are all the levers that you pull to help support employees on retirement planning. But that mental model doesn't exist in mental health. The answer has only ever been for 85 years, well, we have an EAP, despite the fact that nobody uses it. And so what you started to see at the beginning of COVID, which has only accelerated, is basically companies throwing everything against the wall to see what might work, right? They license Calm or Headspace. They start introducing mental health days. They say, you know what, we have a big issue. Our leaders at the company, both managers and the executive team, they've never been trained on mental health. We train leaders on all kinds of issues. We don't train them on mental health, and so leaders don't even understand how to spot the signs of what their team might be going through. They might misassociate what they're seeing from their team. Oh, this person is just, they've withdrawn, they don't care as much, they're quiet quitting. When actually it might be something that if you understood a little bit better what to look for and how to have those conversations, you could have a more important dialogue. So what you're seeing is basically companies thinking about both benefits and the overall workplace. What does that look like? And I'll give you an example. There's a company called McCann World Group, which is part of Interpublic Group, and 15,000 person agency around the world, creative agency. And when their new CEO took over in, I think it was January of 2020, they launched a whole bunch of things down to one of the issues that they saw early on in the pandemic was people, because they were working from home, they were never off from work. They were always felt like they were on. So they implemented a system where from the last email that you sent at night, you were locked out of your email for 12 hours, right? And the idea was if people are working 24/7, 365, even if we tell them to take time off, they're not taking time off, and they feel like they're always on the clock. And the idea was, what Bill was working through was basically, we just need to try 6, 10 different things and see what works. He started getting reports. He told the 200 people, most senior people of the company, I don't want any more emails on the weekend. And I'm going to get a report every weekend at the end of the week, on Monday morning, of how many emails you sent. So stop sending emails on the weekends, people have time off. And so I think the reason why I say all this is basically, we are at the bottom of the first inning of reimagining what are the things that companies can do, and what responsibility do leaders have to ensure that their colleagues can thrive at work.
Yeah, that's really interesting. I don't, as a journalist, it's hard for us to turn things off, as Anna said, but I have been trying to schedule emails, you know, like, so if they could hold, you know, or Slack messages until Monday morning, but it's definitely a learning process for me.
I agree with that.
Sebastian, you've worked with many boardrooms and investors who are trying to figure out better ways to support the mental health of employees. What role do you see institutional investors playing in seeking more sophisticated engagement on this topic?
Sure. I'd come at it maybe, I think, a couple ways. First, you know, what's new and what's not new about these issues. So the one item that, you know, you're addressing that's not new, whether in the U.S., whether overseas, individuals and families, right, and employees of all walks of life have been grappling with these topics of mental health, of wellness, of well-being, whether it's viewing these issues as sort of the absence of illness, or viewing it even more thoughtfully, in addition, as to, right, the presence of true well-being, right, and full integration. What happened, you know, I think particularly through the pandemic, is institutional investors started to engage with companies more on these topics of human capital management, around culture, around wellness, around safety, all these items. The one item I want to kind of highlight, though, and this is really from across the pond in England, prior to the pandemic, there was a small investor group that had started to engage with the biggest UK employers on what are you doing on mental health as a discrete issue, not kind of in derivative or other type of topics. They engaged with some companies, wasn't that much traction. The pandemic, of course, right, kind of heightened level of focus on this. Where this group is now, at the CCLA, they've got a group of, you know, institutional investors, trillions of dollars of assets. They have gone now to the top 200 companies in the UK in a couple weeks, and this sort of to see what will become. They have been now assessing the world's largest 100 companies. And it's from this investor lens on a number of areas. But it's, what does it mean to give life and meaning to prioritizing mental health, worker well-being, worker safety, thinking of this beyond just physical health, right? Do you see CEO level commitments around these issues? Do you see people going throughout the organization, for example, to train managers, right? How do you identify, respond, engage on these sets of topics? And also pushing for disclosure, transparency, so that investors can assess, right, all of these issues. This is completely uncharted, right, territory. And what I would just sort of end with this section, though, coming back for the investors and also sort of at the CEOs, look, within the past, 6 to 12 months, there's 3 CEOs I just want to briefly highlight. Roz Brewer, right, she's CEO of Walgreens now. John Donahue, who's CEO of Nike now, and Satya Nadella. 3 totally different industries, right? Different people's all grappled with. So here are 3 things I want to just highlight, right? Satya says the following: well-being has been one of the most important pieces of productivity. Anything's possible for a company when its culture is about listening, learning, harnessing individual passions and talents. Creating that kind of culture is my chief job as CEO. When Satya recently was asked, what's the key to innovation? His surprising answer, empathy. Empathy. That if you want to meet and understand unmet needs, it's about empathy. John Donahue, of course, look, Nike now, as part of offering expanded services, right, for mental health by Nike, says top performers are not afraid to ask for help. They view asking for help as a sign of strength. We know mental health has no off-season. And Roz, of course, advice to other business leaders: put your phones away, listen to your people, That's how to make workplaces higher performing, more equitable, diverse, and fair. And the next level of leadership is getting pretty gritty about listening and acting and making people feel included in the environments that we create as leaders. Mental health, wellness, and well-being in a holistic sense, this is key to all of these areas, and how CEOs are grappling with it, and we'll get to this, I'm sure, later, boards of directors of companies, right? And there's a number of items that are going to be on the horizon, believe it or not, even on the regulatory front, that will, I think, propel these issues rather than let them be put back at the bottom of the barrel.
Those are great points, yeah. Andy, your turn. You've obviously been very active in the startup world and have worked as a CEO and investor in many entities. How do you see the Millennial and Gen-Z generation playing a role in this new emphasis on mental health and well-being of people from every level of the company, from the founders to the employees?
Yeah. So, I recently wrote a memoir about my 20-year journey with bipolar disorder type 1. And just how ashamed I felt for so long that I had this illness. And in fact, we make the illness and the identity sometimes equivalent when it comes to mental health. So, you might say, oh, so-and-so is bipolar, but you would never say so-and-so is cancer.
Right.
So it's interesting, even in the language, how mental illness tends to be an identity conversation, whereas physical illness is a treatment conversation. And so the goal of writing Burn Rate was, let's normalize disclosure of mental health in the workplace. And my story is a little spicy. I was diagnosed when I was a senior in college, in denial of the illness for a decade, started a company, going through all the highs and lows of the company, which tends to sometimes cloak what's happening underneath or amplify it. And then in 2016, it came to a head. I had a second manic episode, psychotic break, 16 years from the first one, ended up in Bellevue in New York City, spent a week there, finally got out, ready to deal with it, and was discharged into handcuffs and charged with felony and misdemeanor assault. Meanwhile, 9 years into building a company, it raised over $100 million, 600 employees. And only 20 people knew that that happened at the time. And through the remarkable faith and perseverance of my wife, family that rallied around me, management team, board of directors that was empathetic, and perhaps most importantly, a great regimen of medical care, doctor, medication, sleep regimen, all of it, got through it. And the normal thing to do would be like, well, let's make sure no one knows that that ever happened, right? But decided in the midst of the pandemic, while dealing with the mental health challenges that many of us were facing in different ways, that it was time to write a memoir about the ones that I had faced. And so we're about 3 or 4 months from publication date. And I'm like, oh shit, I gotta tell my existing team that this is coming. None of whom know me, because they didn't work with me previously. And it's a team of, at this point, maybe about 12 people. And virtually everyone in the company would fit one of those two cohorts, Gen Z, Millennial folks. So I'm on the Zoom, and I'm basically telling my deepest, darkest life secrets and saying it's coming out in a book. The problem with the Zoom is you can look at everyone's face and very quickly be like, well, how are they processing this? And the primary thing I saw in people's faces that was really upsetting was they appeared to be bored. Really, you're bored with this? Like, and also, there's a lot to the story, and so I found myself getting nervous, a little panicky, leaning into saying more, almost like trying to get a reaction in a weird way, where the story itself is reaction-worthy in and of itself. So I got off the Zoom call, and my heart rate was 200 beats a minute. I was like, that was a disaster. Like, I felt like this long-running stain of severe mental illness, I always imputed that meant that no one would want to work for me. Who wants to follow someone who is on the record as having a severe mental illness like bipolar disorder type 1? Are you ever going to have credibility? Are you going to be viewed as, well, let's not take that seriously, he's up, he's down, he's whatever? And yet we already do, right? So 2 to 3% of the general population has bipolar disorder, type 1 or 2. We think that index is 7 to 1 in entrepreneurs. So that would be 1 in 5, 1 in 10. So I get off the Zoom and I DM'd my top deputy and I was like, that was a disaster. And she was like, no, that was awesome. Like, no, that's great. Like, everyone appreciates vulnerability, and like that was it. Like, it wasn't a big deal. And I think that's what we're confronting right now, is that many of us grew up and belong to generations where that is an extraordinarily shocking disclosure. And I think, you know, maybe the older you get, the more shocking it might be. Some of this varies by culture. And then to these up-and-coming generations, there's sort of like a default to vulnerability or transparency that it's almost expected. And so it was a wonderful thing to realize how welcoming, and seeing from the process of the book, how eager we are as a society to have this conversation. And then the other learning, which is like, no one cares that much about you. I mean this in a nice way. Like, no one's sitting here thinking about you all the time. And so if you release yourself from this concept that someone's really going to be affected by your disclosure, well, then just fucking say it, so that people know what's up. And turns out it's probably going to invite people in more,
Right.
than you holding back this, you know, important part of your life story.
What kind of response have you had to your book? Like, anything surprising or?
It is a universal issue. There is not a family that doesn't have a story. There's not a person who makes it to 40 without themselves having had a major mental health challenge. Set aside the fun and exciting diagnoses. Whether named or not, you don't make it to 40 without having been thrown on your ass by something. So it's universal, and it's universally under-discussed. It's nonpartisan, which is exciting. It's every family. So I have found it's been like jumping into a wall of pillows. There's so much affirmation, not because my story is so compelling, but because people want a chance to share their own.
Right.
And so it's kind of a lightning rod when you make a disclosure. This gets back to what Phil was saying around how to have the conversation. It turns out if someone discloses a mental health issue to you, it's not the right time for you to be like, well, yeah, and I have this, which is our tendency. Well, I have that too. Or,
Right.
You're depressed. I'm depressed right now. Do you want to go out? Come on, you're not that freaking depressed. So I think we're ready. And, you know, I've gotten a few thousand messages, and, you know, sometimes going through them, and at one point my wife's like, you're a mental health patient, not a mental health professional. Like, your job is not to sit there on your LinkedIn DM box, you know, trying to figure out how to help people. That's what we got Phil for.
Right. That's great. All right, Phil. So how do we do this?
No, I mean, you know, it's interesting to pick up on one of Andy's points. The front door issue for companies is stigma in the workplace. That is the fundamental front door issue, because you have this weird dichotomy between how universal the experience is, whatever your experience is on mental health. There's sort of a universal element to it, and yet, as he said, it is universally not really discussed in a meaningful way. And the core, and part of why I think what Andy has done is so important, is it all starts with the CEO and the leaders of the business. That if they are not role modeling, if they're not talking about it, doesn't mean that they have to have the exact same story as Andy or it's not valid. But being able to talk about it in whatever lens, your kids, yourself, your parents, a friend of yours, being able to signal to the people who work with you and for you that you value this issue, you value people who are going through something, that they shouldn't be scared to talk about it. That is the fundamental, and that's what I think sort of this moment is partially about, is how do you get, you know, how do you get CEOs, how do you get the Roz Brewers and John Donahoes of the world, or Satya Nadellas of the world, but also how do you get sort of this new generation of founders and CEOs who in so many ways have redefined what businesses should look like, what the workplace should look like, this sort of new establishment founder types, because those are the businesses that have set the norms for big institutions, right? Those are what the big institutions end up following. And I think that's part of what the opportunity here is how do you get more business leaders talking about the issue? And I think that's also the role, one of the interesting things that's the real opportunity for the media, which is, the truth is that in my experience working with a lot of CEOs of public companies, is that no matter how big the company is or how important the business leader is, everybody is taking cues from everybody else. And so when they are reading news coverage about mental health, in whatever form it is, that becomes the impetus for them to act. There's sort of an arc that business leaders I see go down, which is, when you first start talking to some people, they say, oh yeah, I know that's a big issue, but never impacted me in my life or anyone that I know, right? And then as you sort of give them more exposure to the issue, suddenly they start saying, hey Phil, can you believe there was a story in the AP this morning? You gotta read it, it's unbelievable. I can't open the paper, I can't wake up a single day. There's articles in the Times and in the Washington Post every day about mental health. We gotta do something on mental health. And eventually you get to a point where they say, oh yeah, by the way, my grandmother was bipolar.
Had bipolar.
Had bipolar. And the idea that there's anybody who is not touched by this issue is totally false. And so, being able to raise the conversation level around it, I think, is really important.
That's very true.
I was just going to build on this point of how do you normalize, right, these conversations? And I just want to commend you, Andy, thank you for your sharing, right, and also sharing, continue to discuss it, right, and engage, on these issues and, the work, Phil, that you're doing. On the point of there's no playbook, right, there's no standards, there's no, item on this. Mental health will always be one of these areas. It's going to be so unique, right, to the individual person, to their family, to their circumstances, right, to where they live, right, to issues of luck, right, kind of in the life, other external events, and the like. But, on this notion of tone at the top, right, but also, and there's a point, you raised around training, right, a term we use in other contexts sometimes is tone through the middle as well, right, because for many people, whether, frontline workers or, lower level employees, how much interaction are they really having, right, with the CEO or the board of directors? They're interacting with so many other people throughout that organization. And so I think it's very interesting, particularly as investors start to assess this and trying to assess it in more objective ways, this new focus on, well, what's happening throughout the overall enterprise. Walmart is a company that recently said, we're going to initiate very comprehensive levels of training throughout that organization. Again, on how do you identify sort of people who need help and support? How do you respond to it? How do you develop it? What do you do with that? I think there's also some emerging practices such as a term called trauma-informed workplaces, right? And you have experts who do this, and it's, well, what does that really mean? But this notion of moving beyond the the EAP, because what's basically an EAP? Okay, go call someone else, right? And yes, look, we'll pay for it, provide benefits, obviously sort of important, not utilized. But it inherently continues to kind of create and propagate that there's these silos, right? Mental health, well-being, wellness, oh, that's something that you have to deal with outside of your workforce, outside of your place of work. One of the items that's, again, I think interesting sort of on the horizon, there's these set of standards, and some of you may hear, ISO standards, ISO. And the issue is companies want to say, am I ISO certified? And they might get an audit, pre-audit to get certified. Well, ISO did something fascinating, and they do it with occupational health and safety, which, physical safety and the like. ISO has now put out, very, very recently, the first international standard for another kind of complex term, psychosocial matters, psychosocial risk, right, opportunities. How does that play in? Well, what's psychosocial? That's how mental health, wellness, and the like. Very new, but it's been formally developed. Any of you knows these ISO standards, right? I mean, these things are very, right? This is robust, as with anything, corporate related. But companies are starting to say, wow, is this a way in which I could be, externally assured, certified? Completely new. It's going to be very complicated. It is different. There are companies that think about, right, the UN Sustainable Development Goals. And one of the SDGs talks about health, right, and well-being. Well, one thing that wasn't fully clear is, well, does that encompass mental health? Well, they've now made clear. Of course it does. And these issues on the horizon, the U.S. Securities and Exchange Commission, there's been a lot of focus on new regulations, right, is on climate change, right, are there sort of other issues dealing with activist hedge funds and what's happening to corporate America. But there's a rulemaking that's going to come out soon that people aren't really kind of focused on or talking about human capital management. And we'll see what it is, that Chair Gensler and the team sort of issue. But one area that they're being asked to do is require companies to disclose metrics around human capital issues, right? Provide, and also right now there's sort of more principles-based disclosure. Will we see required disclosures about, investments and cost of the workforce, on turnover rates, on retention, on productivity? What exactly does it mean? How do you describe a company's workforce? On demographics, diversity-related issues. Again, we will see what gets put out there. But investors have already been pushing companies, some companies have been doing, which is talk to me about retention rates, promotion rates, across sort of different sets of issues. As more data comes out, as well as a point, Phil, you made the other day, which is, will these issues of mental health, wellness, well-being follow a similar trajectory of other kind of critical issues that are not purely financial, of do we have standards? Do we have board governance oversight? Do we have targets and goals? Right? Remains to be seen. One very well-known company has, believe it or not, actually said, in a sense it's part of ESG sustainability, but it's actually just core kind of value creation strategy culture. They said, we're going to have 2025 targets and goals around wellness and mental health issues. And then we're going to have 2035 ambitions. We're actually going to track ourselves on this. Again, this is entirely uncharted territory, but it's how you have these CEOs and these boards, and look, also people on the front line or the lower level saying, is this a way to make corporate purpose, meaningful, and give people an even more powerful reason, not just to come to work, but to really embrace the dignity, right, of work.
Yeah. I could just follow up one thing I think that you mentioned, sort of beginning that question, I think is really interesting, as you said, sort of like the CEO is one thing, but it's sort of the frontline managers in many ways, are the ones that kind of spread things through a company. And I agree with that 100%. And I think it's a real challenge. Myself being one of those managers, I manage managers who are those managers. And I do think this is something, it's so important whether you're in the same, like most people work within the same location, or like a company like ours where you're so spread out that people will go their entire career without ever maybe meeting the CEO, having much interaction with that, maybe one time ever. They don't, they're not in a building. And I think even those who are kind of in a building, because of lots of hybrid work situations, it's so spread out. And just that, having more support for how, the sort of the managers and for people managing those managers to support that kind of ecosystem that you're trying to create for well-being and mental health is just so important.
Yeah, I totally agree with that. My company is very small, but we're scaling larger, and we're trying to work through those issues as well. And since you were working in a startup, how do you see this fitting in with?
I think we have a problem with remote work. You think about the decline in, let's take even where we're in DC, like, where did you connect with people who were different than you? We rewind the clock, and I guess there was a home, there was a workplace, and then there was a set of community institutions, the famous one being like religious gathering places. And then at some point, as that started to decline, that third leg of the stool about 20 years ago, the third place became Starbucks, right? That was like the joke. The third place is now Starbucks. Well, Starbucks is now the second place, because our daily rhythm of being together in person in a tribal environment that isn't our family, the workplace, is now in this hybridized model. In the hybridized model, whether it's fully remote or partially, I'm not sure how good it is for humans. It feels like it's necessary now that we're here to manage our lives. But that's mostly because the people in charge of the world have families. And the flexibility conferred, created some benefits that now we're kind of entrenched with, I think. But for people in their 20s,
Right.
we moved our startup to 3 days a week, mandated in person, and there was a bit of a revolt. And now it's like, oh, we actually like this. And it's like, oh, really? Like humans actually like being together, doing stuff together? And that's how mentorship happens. That's how spontaneity happens. That's how bonding happens. They say the #1 driver of your happiness at work is having one true friend at work, right? And how do you develop a true friend at work if you never see that person, Who needs another Zoom happy hour? I mean, shoot me now, right? Who wants to do anything that they don't have to on
Right.
Zoom? No one. No one wants to do that. So I think we have a challenge, which is we've sold ourselves a narrative and gotten kind of stuck into something now work-wise that I think might amplify our mental health challenges in the name of more flexibility, which I do want to acknowledge. For some people, it's a game changer. Working parents, no doubt, but it comes with costs.
Yeah, the personal connection definitely means something important. So.
I have to say, I mean, I think the flexibility is super important. It is something that people need, and myself included. I also think one thing as a manager, I appreciate, since we have been going back to the office, that connection to seeing people. It's hard when everyone you manage is all remote. I mean, where I work, I'm always managing people who are not in the same room as me. Like they live all over the place, but not to have anyone that you might actually see in person. It is just hard because it's harder to know for sure how someone might be doing or what has changed if you don't have that sort of, there's a lack of spontaneity when everything is like you have to put a Zoom call or get a Slack message. It doesn't quite have that same it just sort of happened. And so I appreciate having that flexibility of sort of in the office and being able to have remote work, but it's a challenge for sure.
Through the pandemic period, and we can debate whether now, what does that mean, right, in terms of current kind of pandemic-related dynamics, the like. But the U.S. Surgeon General put out this fascinating piece, an important piece around youth mental health, right? So we're talking about our children, right, our teenagers, our cousins, right, so his families. And one of the pieces in this work was that what's the role of employers, right? Employers in their communities to, protecting, safeguarding, facilitating, what it might be youth, mental health. And again, youth mental health, that's really family mental health. And I think, again, we're going to continue to see, and Phil, you said at the outset, are we at a moment of reimagining the relationship between the corporation and the worker? Well, we're also in a moment, which has, I think, become a movement, reimagining or reassessing the role of corporations in society, right? What does it mean? It's interesting. We're often involved where companies are thinking about succession planning, right, for the C-suite. And what is very fascinating is what's the profile of the ideal CEO? How has that evolved? And what we've been seeing, because as we work with these executive search firms, work with boards of directors, whatnot around these topics, work with current CEOs who are developing the next, what they're looking for now is really evolving. And yes, there's always high performance, achieving, meeting goals, profitability, all that, but there's also this softer element of, for our next CEO, how authentic, is she or he? How is this person going to be able to, look beyond the enterprise, go across to sort of all these constituents? And with this area of well-being, it's being viewed more as something of, hey, this is core, right? This is fundamental for whatever the rationale you need, right? Do you need, you had it obviously with, diversity topics, inclusion. What's the business case, right? Or the business case for XYZ, business case for culture, where you say that culture eats strategy for breakfast. But in this very fundamental way that all these issues that we're talking about, they're hard, they're challenging, but they have to be a priority. And again, for whatever rationale you need, if your rationale needs to be, how do we ensure American business, right, is competitive? How do we ensure that, if it's American business, is our core engine for economic growth, for employee retraining, right, for having people be excited about their workplaces? All these issues end up becoming table stakes.
Yeah. I think the whole issue of the bottom line is very interesting. Like, how do you see, Phil, maybe you're the right person to talk about this, but how do you see companies being able, and boards of directors being able to say, this is a priority, and we're also concerned about the bottom line? Like, how does that work together?
Well, I think we're basically on the same trajectory that climate has been on for the last 10 years. If you think about it, over the last 10 years, there's been a tremendous amount of work, starting with how do you measure the climate impact of a business, right? I mean, not that we have perfect consensus today, but we had a lot less consensus 10 years ago. Then the question became, okay, once you can measure the climate impact of a business, what do you do about it? What does a company do about it? Do they just buy carbon offsets and keep doing exactly what they're already doing? Or do they actually have to change something about the core commercial operations of the business so that they are operating in a more environmentally sustainable way? And then it led to a third question, which is, okay, well, we need transparency in the market. We need to be able to understand, how does company X compare to company Y on climate? So we need these companies to disclose publicly information around climate. That's why you see every business today now creating these sustainability reports, these ESG reports. That's why the work of the SEC is so important in terms of not just having it be voluntary disclosure, but you need really, forced disclosure and standardized disclosure so that you can actually compare side by side. And the reason why that's important, among many reasons, is you want to be able, the ball game here is being able to demonstrate through data the materiality of these issues. That companies, being able to prove that companies that are better on X climate factor actually perform better over the long run. You can't do that unless companies are collecting and then disclosing that data to the public. Nobody has access to the data. You cannot prove meaningfully materiality. And so I think if you look at what climate, the path that climate has gone down the last 10 years, I think that mental health is just 10 years behind. And I think that part of, as we accelerate the shift from a manual labor-based economy, I grew up in Pittsburgh, so very used to the sort of Rust Belt, old economy model. In the manual labor-based economy, you needed workers that were physically strong, if they were working in the mills or in the factories, right? In a knowledge economy, you need workers that are mentally strong and resilient. Mental health, burnout, become fundamental economic threats to intellectual capital intensive businesses. If the core of what your business is the intellectual capacity of your people, then if they're all burned out, if they're all dealing with severe depression, if they're all, that's a fundamental economic threat. And so I think the path that we have to go down as a country is basically those same couple elements. How do you measure? You need standardized measurement. How do you measure mental health of a workforce? Most businesses today are not collecting almost any data on their on employee mental health. They're looking at the utilization rates of the benefits that they offer as a proxy. It's an interesting question. If the utilization rates of your EAP suddenly are high, is that bad? Does that mean that there's a lot of people who have a lot of need, or is it a net positive because it means that they're actually getting help about it, right? And so it starts with you need some consensus around sort of how do you measure the mental health of a workforce. Then you need standards around, okay, well, what do you actually do to improve what actually moves the needle? And then you need companies to disclose. That's why what Sebastian was talking about what the human capital management disclosures are and what the rule might look like from the SEC is really critical.
Mm-hmm. Do you have thoughts on what those should look like?
Well, not at the moment, but I do think, and part of the reason why is we're at the very beginning. The work that we're doing, the reason why we exist is there is a severe lack of research and work on this exact area. So the whole reason why Project Healthy Minds exists is we're convening top clinical experts, Dr. Ray DiPaolo, who's in the room, CEOs, heads of HR, economists, because we think that there is a decade project here around how do you actually get to the core of all of these issues? How do you demonstrate materiality?
I guess the question is, right, can we wait a decade?
Yeah, probably not, but you have to get started with something, and you need it to be, there is a lot of virtue signaling that is happening in corporate America on mental health. People signing pledges, and pledges are good. It's important that companies signal to their own employees and to others that they care about mental health. But if you're only signaling, if the signal is the beginning and the end of what the company is doing, then you're perhaps not living up to what the point of that signal is really supposed to be. And so I think the key is kind of like, being able to demonstrate through data this stuff is hard. You need companies to sign up. You need them to basically open the kimono around, how are their own employees doing? That's why we exist.
Make a quick comment. One of the items where, what are people grappling with now, right? While waiting for your playbooks to be developed at the sort of the national standards. Boards of directors are coming under increasing scrutiny as to, any issue that rises at a company level, right? A risk, right? A crisis occurs and the like, fairly or frankly often unfairly, it's, well, where is the board, right? Sort of on the issues. On the topics of culture, of human capital, of employees, of team, as well as issues of profitability, bottom line, and the like, there's this renewed or new, I would say, kind of real scrutiny of, well, is the board engaged on the topic? And so one of these new kind of mental health benchmark assessments that's being pushed by investors asks about not just is there a commitment at the CEO level, but is there governance around this? Now, you can push back and say, well, what is it? How can there be governance around mental health or wellness, or how can there be governance around climate issues and the like? But I'll kind of reframe it, maybe simplify a little bit. We will get to a point where there is more external disclosure data reporting on topics that relate to the well-being of the workforce. But one thing that is already starting to happen and will happen more is internal reporting to the board of directors on things like employee engagement, right? Could that be a proxy? Or say something about the culture or the wellness, Issues about utilization rates, right? What are the actions that we're taking to promote, maintain awareness, year round? And I think that's also an exciting area. We'll see whether or not there's real public disclosure around any of that, but it is something that's happening today, and that boards of directors and CEOs and general counsel, everyone's working through this.
What gives me a lot of hope and optimism is actually Andy's story about when he talked to his own board and the react. Do you want to tell that story? I know it's in the book, but it's an amazing story.
It was a tough call. I was a couple days out of the psychiatric ward. I had a pending felony arrest charge. And my board had no context for what I had to tell them, so I arranged a call. It turns out you can get a board call organized very quickly if you cryptically say, we need to have a board meeting
Nothing
tomorrow at 7 p.m. Normally it takes like 4 months to schedule one, and it was like everyone was ready. I had my sister in the room for moral support, and one of the things I realized is it only takes about 60 seconds to communicate like an ocean of pain. Like in your mind, you're like, how could I ever explain something? And then you realize that you can explain something in just a few sentences, and so how do you? So I had to write down what I was going to say to get it out quickly. And so basically I said, I've been closeted about a mental illness I was diagnosed with when I was 20. It's called bipolar disorder type 1. I'm sorry I never shared this with any of you. just came back in a really mean way. I spent the last week at Bellevue. I was charged with felony and misdemeanor assault on the way out. And I'm working on a bunch of things to figure out life. But that's the table setting for what I want to talk with all of you about with all of you today. And there was a long pause. And the first thing our board members said, it was a guy named Joel Peterson, who's been on about 40 boards, who's then the chairman of JetBlue. He said, "How's Manuela?" That was the first thing he said, asking about my now wife, then girlfriend, who I had struck during the manic episode of violence. And it brought a tear, because the first question or consideration wasn't something about the company, it was about, and it wasn't even about me, which was also cool.
Yeah.
It was about her, and it just set a tone. And then the next person that spoke, one of the co-owners of the Chanel family, said, I was afraid, that it was something like this, and you should know that there are a lot of people who deal with this kind of issue, a lot in the business community, a lot I could tell you about, but I can't tell you. And so you're in good company, and now let's figure it out. And from there, I brought a plan. I basically said, here's what we're doing on every dimension. If you want me to step down, I can do that. If you want me to stick with it, here's the law firm, here's the crisis PR firm, here's all the stuff. And there were so many vectors of privilege by which we were able to get through it. I had a great lawyer. I had the understanding of my mother-in-law, now mother-in-law and wife. The first time I saw my now mother-in-law afterwards, she was the one I pushed her to the ground and kicked her, which is the felony charge, felony assault of a senior citizen. I wasn't even allowed to see Manuela at the time because of a court restraining order. So I went to meet with Baba. And the last time I saw her, I was unclothed and assaulted her. And so you might imagine thinking, I wonder how this lunch is going to go. And we sat down for lunch, and she immediately put her hand on my hand, and she said, "Andy, this is just like diabetes. You got to take your meds and see a doctor. And if you do, I'm good with you. If Manuela's good with you." And just the tears streaming down my face, because no one had ever equated it to a physical illness. I thought it was some special kind of human stigma or a source of shame. And so, back to the question around, and you cheated up around boards, it's like if we can meet people when they bring a disclosure with empathy and concern and love, wow, like we can change the world with that.
I love that.
Yeah, that's really great.
Yeah. Thank you for sharing that. Yeah. Okay. Unfortunately, we're out of time. This is a large discussion that hopefully will continue. I wanted to take a moment to thank all of our panelists today for sharing their insights and experiences and personal tales. I'd also like to thank Project Healthy Minds for their work in this space and for partnering with us on this program, and to FGS Global for bringing us together. And thanks to each of you for coming here today. I hope you've learned something and can take some, have some takeaways from this talk. And we will have this on our YouTube channel, so please check it out later and share it with your resources. Thank you.
Thank you.